Ready, sir.
Hey, is my mic on? Hello, 1, 2.
Yep,
Not that
sounds
anybody
good.
would want to listen to me. Talk for 30 seconds. Hey,
Yes, sir.
Doc, give me your name, spell for me, your big title, how long you've been doing this as coroner.
Sure. Dr. Kent E. Harshbarger. I've been the coroner since 2011. I've been here since 2002. And I'm a board-certified forensic pathologist as well.
Hey, how we sounded?
Sound great.
So, to what degree do you believe that meth has made a comeback and it's here with a vengeance?
It's certainly here with a vengeance. We see it in most of our deaths now. It's combined with fentanyl, but meth and cocaine is present in a large percentage of the deaths.
Why is that? Why has it come back?
I'm not really sure, other than it's a very cheap product on the streets right now. It's professionally made south of the border, brought here. It's called ice. It's being put on our streets and people are using it.
What's attractive to people about it? Is it just price?
It seems to be that price is one of the factors. Obviously users are seeking it out in combination with fentanyl. I'm not sure it's fentanyl and meth being used, or they're being used together. It's just sort of mixed in the powder, except meth comes as a crystal, so it really can't be really mixed in the powder unless it's ground up.
Meth, when I talk about that, me personally, I think of meth as being a product of the 90s. That's when it really came on the street. Is that accurate? And secondly, it was big then and then kind of went away for a while. Is that true? Is that common, that drugs rise and fall in popularity over time?
I think that is true. It's one of the lessons from the opioid epidemic is that we start focusing on one compound instead of treating the problem as a whole. And by focusing on opioids alone, we perhaps maybe allowed meth to come in as a substitute product without noticing it. But meth has had swings up and down, similar to the speedballs in the 70s and 80s where it was cocaine being mixed with heroin. Now we have fentanyl being mixed with cocaine and methamphetamine.
Okay, let's talk some science. How different is today's meth from 20 years ago?
It's a much different product that's being provided on the streets. One thing that's gone is the home baking products, the home labs. This product that's on our streets now is a professionally made, quality controlled sort of product called ice. The purity's there. There's very few cutting agents that we're finding through the crime lab with the meth product.
How much of this are you seeing on the street? How often is it that you say, okay, now we have yet another piece of evidence to test here?
It's very frequently brought into the lab through a seized substance, and the other thing we're seeing is larger and larger volumes of meth being brought in. In the older days, we'd be surprised to get a couple grams of meth. Now there's 600 grams or more in a seized product.
Wow. What was your reaction when you started to see this happen?
Fear, of course. I mean, one of the things is just like the opioid epidemic, now we've got another product on the streets that's causing deaths. One of the complications medically is not really understanding what we do to the individual who has an opioid on board and meth, and then provide Narcan, which really only blocks the opioid. Do we now just cause a cardiac event because we've slammed meth into the system visually by blocking the opioid? So there's a lot of complications that we really don't understand.
Explain that for a minute, because yes, we know that people who are on heroin, they pass out on the street as an overdose. If they're found,
right,
or at home, you can give them Narcan, and that blocks the effect of that and saves them.
Correct.
What can you do for meth, though? Does it work?
Exactly right. So we're blocking the opioid part with the Narcan, but there's nothing to block the meth effect or the cocaine effect when they've sort of been balancing each other out. One's a depressant, one's a stimulant, and now you've taken away the depressant rapidly by giving Narcan. So that stimulant's floating around there and the body's seeing that immediately or acutely. We don't really understand the effects that has.
Okay, let's talk some chemistry now. What does meth do to a person who uses it on a regular basis?
Well, it is a stimulant product. The bad thing about methamphetamines is it's really a poison, I like to call it or refer to it. It's very deadly to cellular tissues, and that's one of the reasons you see the dramatic decline in how a person appears. The teeth are damaged with use of meth because it really damages tissues over time.
Much like heroin and opioids, can you overdose on this?
You can die from it, but it's really sort of a different concept than overdosing. It's a cardiovascular collapse, so the heart can have an arrhythmia, those kind of things, versus the level getting high and as an opioid would, a concentration getting high as an opioid would, causing an overdose. So in meth, it's really more of the body reaction to the meth causing the death versus what we would consider an overdose. There is no one level that you can say, at this concentration cocaine causes death, at this concentration meth, any cocaine can cause a heart arrhythmia and someone to die. So it's a different concept than an overdose where we have concentrations we're trying to determine.
Do you have a sense as to what, for users, what that experience is like? Is it that instant euphoria that comes with heroin, and then when you come off, you get, quote, dope sick? Does meth do all those same things?
I don't really know the answer to that. I think it is that euphoria product. I don't know about the low part. I think that people chase that euphoria over and over again.
How strong is that addiction, whether it's physical or mental?
I think it's on the par with an opioid addiction, or perhaps worse, because the chemical is damaging the body over time.
For you as a community leader, how scary is it for you to see this come back now?
I think it's as scary as the opioids, if not more, because meth carries a behavior component that the opioid addiction didn't. There's often more crime associated with it. It's not killing people, and then their addiction is fueled with a need for more. So it brings with it typically, and I'm sure others, law enforcement community can comment, it involves more community unrest, I guess is a word. More crime is involved when meth is in a community.
Why is that? Do people act out or become more violent necessarily?
I think they become more desperate for the product over and over again. It has to be refueled, and they're not having the deaths like they did in the opioid epidemic, so the users keep coming back and needing more and more.
It's amazing. Does it affect men and women the same way? Does it affect people who are young or old? Does it have any differentiation there?
It should be the same way. Should affect everyone the same stimulant properties. Obviously, the younger you are, the older you are. At the extremes, you're going to have more health issues that the meth can damage, or more heart disease in an older population. And then you take meth, that's a really horrible combination. Or younger, asthma, other things that meth would be a really horrible combination with.
Two other questions. How long would a user go, in your estimation, before this really starts to see the body break down? You're talking about dental work, tissues, facial loss, all that.
From my experience, it's months until you start seeing changes, usually 6 to 8 months before it's really pronounced with a chronic use in an individual. But of course, there's immediate effects. The first use of meth, someone can die from a cardiovascular event from that stimulant component. So there's an acute risk every time someone uses cocaine or methamphetamine, but methamphetamine carries that over time destruction of the body.
Is there such a thing, much like heroin or alcohol even, someone who could actually do this drug and kind of get away with it, do it in moderation, and still be a functioning user?
I think that probably exists, although in my experience, the levels and the use accelerates, and that's when they get into trouble, and that's when the tissues start being injured quickly. The skin ulcerations, the teeth are lost. Those kind of things happen as the use increases. And I'm not really aware of the moderation user with meth. It just typically just accelerates and the need continues.
It sounds like those people are all in.
Correct, right, all in.
And then finally, I want to ask about the lab work here. So most of the material that you're working with is coming through a bust. You're just identifying what it is, the quality, quantity, and what it really is, because you can't tell what it is by looking at it, can you?
You cannot tell by looking at it, though we have an idea. It's a classic appearance. It's one of the reasons it's called ice is it looks like crushed ice. It's a very crystalline material. So we have a good idea it's going to be meth, but until you test it, obviously it's not proven until we test it. And so, as I said, we're seeing more and more larger and larger volumes in the busts.
And just as a follow-up, so as a community leader, can we do anything about this?
I think it's a problem we attack the same way we were attacking the opioid crisis. It is a community problem, it's a law enforcement problem, it's addiction services problem, and from my perspective, we have to get in front of the addiction problem. Why are people choosing to escape with these kind of compounds?
Yeah, because they're looking for something, and if this is a money thing, they're just picking whatever they get high on, whatever happens to be readily available on the street. They get $5, they can hit on that, and it's not really a choice. It's just whatever path the river takes them.
Potentially, I think that's correct. It's whatever path they find on the street, whatever products there are cheap enough to keep using.
Michael, what are your many questions?